Our member needs paper towels, and you can see the shelves are pretty empty.
We thought maybe she'd dig through it.
There was no option to say, oh, I'm afraid.
I can't expect them to work for free either. They got families and bills too.
But this is a pandemic.
Indiana has in fact received its first case of coronavirus COVID-19.
One year ago today, March 6th, 2020, the novel coronavirus was confirmed in Indiana. Thanks for joining us. For COVID-19, 1 year later, I'm Dirk Rowley.
And I'm Tara Brantley. From the initial shortage of groceries, toilet paper, masks, and respirators to the current hope for herd immunity, Wayne 15 has covered every piece of this pandemic. The last public event many of us remember in the old normal was the Fort Wayne Home and Garden Show. That was also the first time we heard about a case in our area.
We became aware of a case. Again, there's no cases in Allen County, but a confirmed case of COVID that did attend the Home and Garden Show on February 27th.
At the Home and Garden Show that weekend was Decatur resident Wally Gregg, who first noticed symptoms that Sunday. His diagnosis was confirmed March 11th. He would go on to be treated with a drug most of us had never heard of. Wayne 15 Sierra Tufts catches up with him 1 year later.
When we first met Wally Gregg, he told us about his experience receiving remdesivir for COVID-19. Gregg spent 16 days on a respirator and weeks in the ICU, sometimes completely unconscious.
I was one of the more severe cases just because of the respiratory issues. They started me on oxygen. I was on respirator for 16 days.
That was 61-year-old Wally Gregg in May of 2020. 2 months after receiving his COVID-19 diagnosis and being on the brink of losing his life.
I was very lucky. I had a lot of good care from, both the Adams County Hospital and Parkview North, and I was very grateful for that.
Wally received the experimental treatment remdesivir. At the time, he was one of 2 people to receive the treatment at Parkview Health. Parkview Health says it's still using the treatment and expanded the use to most of its hospitals. Even though Wally received his diagnosis a year ago, he's still feeling the effects of the virus.
No, I don't think I'm 100%. I don't know if I'll ever be 100%. I last said I thought I was 97%.
It took Wally about 7 months to get to that 97%.
Through that 7 months, the toughest part was the upper part of my body was really weak. My shoulders were very weak. They'd almost like melted away when I was in the hospital.
The past year has also given Wally time to reflect.
You have a much greater appreciation, I think, of everything that you do in life. And you hold people so dear to your heart, especially when you went through a time period where nobody could come in and see you in the hospital.
And an appreciation to still be here today.
So I'm just thankful that, it was decided that I needed another chance to still be here, and I just really feel for those families that have had people pass.
Wally says his remaining symptoms are some neck pain and having a foggy memory. Sierra Tufts, Wayne 15 News.
The Home and Garden Show ended March 1st. Normal ended days later. Governor Eric Holcomb declared a public health emergency March 6th to coordinate the state's health resources. March 12th, he announced no more than 250 people in a room. People were encouraged to work from home. Days later, schools began to close and bars and restaurants shifted to carry out only. March 16th was also the first known COVID-19 death in Indiana. And then we heard this.
Hoosiers to hunker down. Stay at home.
That move started a domino effect, and the dominoes fell for weeks. Festivals.
Since it's such a large-scale event, and with so many moving parts, we had to, we had about a week left before we had to make our break and decide.
High school, college, and professional sports.
After Big Brother NHL announced they would be suspending its season, now the ECHL has canceled the remaining games in the season.
There is nothing like hoops in the Hoosier State. Unfortunately, there won't be any more this season.
If Mad Ants basketball won't be coming back this season, the NBA G League has canceled the remainder of that season.
I can't say that we're shocked by it. I mean, we've been preparing internally for this announcement to come.
And concerts.
We're projecting a loss that could be in the range of $2.9 million.
2020 quickly became the year that wasn't. The economy was hit hard.
From just a pretty busy place to zero.
Companies found new ways to do things.
We've been doing a lot of curbside pickups with Instagram and Facebook postings.
With a mixed measure of success. Wayne 15's Brianna Brownlee has more.
Mainstream Boutique, Next Level Fitness, and LPC Nails were a few of the many businesses rocked by the pandemic. Tony Martino owns Next Level Fitness. When I first met him, he was concerned about receiving unemployment and applying for assistance. Now, nearly a year later, he says he experienced about a 20% decline in clients and income, but is happy to still be in business.
Here, because I'm just kind of going with it to see what happens with the vaccines and everything. But I think the more people get vaccinated when that age group comes down, my target age range is from 30 to 50. So right now, those people aren't even able to get vaccinated yet.
Martino adds creativity helped him stay afloat. Becky Glaser, owner of Mainstream Boutique, agrees. She says when the stay-at-home order was implemented, she leaned on social media to push her products, which helped her develop stronger relationships with her customers, resulting in her silver lining in COVID-19's dark storm.
Getting support from my customers is the reason why I want to stay open and the reason why I get out of bed every day. And having that relationship with my customers, that's so gratifying. It means more to me than money.
Longwin's family owns LPC Nails. He told us when the stay-at-home order was lifted, business was booming and they were actually getting clients from Ohio. During this time last year, his family's shop was on the verge of closing. Despite losing a chunk in sales, he says as long as his shop is open and people are coming in, he's happy.
I just wish we were more prepared for last year. We were just blindsided. We didn't know what was going on. We didn't know if our business was going to be able to withstand this, how future clientele traffic will look like. But it's going to be a good year for everyone.
Seasoned financial professionals like Greg Reynolds say it's hard to comprehend the scope and change of the past 12 months.
Everything looks a lot different. And the reason it all looks a lot different and is going to be forever different is because we've had these 3 huge stimulus packages. Many people have received multiple stimulus payments at this point. So that changed their budgeting. It changed their financial picture. They literally took a bazooka to a knife fight. They flooded the market with capital. That's transformational, not just to the way the government spends money, but to the way we all interact with the economy. And there's no putting that genie back in the bottle.
One thing trending in a positive direction is people are saving more, even in a very tough environment like COVID.
Because people have kind of hunkered down and spent less money. Maybe people have been nervous about the future, so they saved more. But bank balances are near some record highs.
Of course, COVID has had a profound negative impact on big chunks of the population, especially those in the restaurant and entertainment industry. Reynolds says if you've been hit hard, it's time to regroup and refocus your finances.
To take that proactive step where you actually say, okay, I'm going to organize these things and I'm going to create a plan and I'm going to get on track now. I had that roadblock and let's figure out the best path forward from an efficiency standpoint.
Entire industries learned to pivot. Instead of drinks, they made hand sanitizer.
This has really brought everybody together through this crisis. So we're very happy to be able to do this.
Instead of purses, they made masks.
A few people in the sample room just wanted to help out, right? Wanted to figure out how we could help everybody fighting COVID, and that's where it started. And then we started making them all around the world, and we're able to make millions of them.
People found new ways to celebrate.
This is your birthday, your 82nd birthday. 82! Ain't that a blessing?
Excuse the tears, but they tears of joy. And there's no way that we will let this day pass and not be able to celebrate such a woman of God.
We are so blessed and so happy to see this day with our mother.
And I mean, it is just such a privilege, and we feel so blessed, and she just makes you feel blessed.
And you would dwell in the house of the Lord forever and ever.
Mom has always been a singer. And the one song she loves singing, I'm singing, I got Israel on my mind. He's sitting high and he's looking low.
Turn it loose and let it go. It might not come when you want it, but it's right on time. Yeah.
Hallelujah.
There's no way that we couldn't be happy. I mean, this is a sad time, but we're happy. We have no choice but to be happy, you know, because of her and her legacy. She's the oldest one living.
Happy birthday to you.
You know, we'll do whatever we have to do to keep up the morale, to keep her spirit going. We'll do whatever.
Through the glass, through the window, through the roof, it doesn't matter. You know, we have to communicate. And we have to show our expressions of love. And I'm just pleased and happy to be able to be here.
We love you so much. Mom used to say, just a little grain of a mustard seed. Let us keep the faith. Let us all love and stay peaceful.
Or get married.
You definitely want your friends and family to be there to celebrate one of the most important days of your life. But then too, a lot of people, you know, for their own personal reasons, made the decision that they didn't want to be exposed either.
Anything to flatten the curve as hospitals remain stable.
Then sings my soul, my Savior God to thee.
But nursing homes and the older population got hit disproportionately hard.
It is so difficult to live with and deal with our mom not only being exposed to it in this nursing home, but having been informed that she tested positive.
Before we get to the trials and heroics of the healthcare workers, we want to turn our attention to teachers. Indiana schools reopened in August. Teachers learned new ways to teach. Students learned new ways to learn and new ways to cope.
We're up to about 37% total remote students, so it's definitely provided this safety factor that we were hoping for and seeking.
The pandemic changed the traditional ways of education, growing and stretching students, teachers, and administrators. Local leaders in schools see the positives that have come from this pandemic, especially creativity that was put in for safe learning. The new normal includes avoiding daily hugs with students, empty hallways, and plenty of sanitation. The new normal also includes paying close attention to details more than ever before, which in turn has helped amp up instruction. The biggest accomplishment, digital learning.
We've had a great learning curve with the leveraging digital. I mean, we now know we can collaborate with anybody around the world, kids or adults. I mean, we've always known that, but it's different when you have to do it, because then it can become part of just your pedagogical practice.
When Evans reflects on how COVID has helped shape education, she believes the virus has been helpful in changing systems and making them more efficient, such as daily dismissal. Reflecting back, educators in Fort Wayne are happy with how the respective districts have handled the pandemic.
Would I change things that we did in hindsight? I don't believe the answer is yes. I think the answer is no. And the reason I say that is because we were very diligent of incorporating and involving public health officials, occupational health, pediatric health specialists, the epidemiologists along the way to make sure that we were well informed about how to do things.
For both districts represented, the mission is the same, ensuring kids are educated and safe. Both feel that there have been benefits over the past year for both in-person and remote students.
Whether waking up to get on the bus or to log onto the computer at the kitchen table, school looks different this year for every student. Local counselors from Fort Wayne Community Schools and Southwest Allen County Schools say that they see one struggle with students more than ever before: loneliness.
Loneliness is different for everybody, right? Is it you miss physically being around them, or is it you miss having connections?
It's been really hard for counselors as students feel this loneliness, and the suicidal ideation rate is up in Northeast Indiana.
Anxiety's on the rise, depression's on the rise. I think that's the concern. Is it, or are we just more aware of it now? Are we just talking about it more? because if we talk about it, we can get through it.
One way or another, teachers, administrators, students, and counselors have gotten through it, one day at a time. Counselors are impressed with how kids have overcome the changes this year has brought their way.
Kids are very resilient. Now, does it take a little longer sometimes? Absolutely. But as a school and as a community, if we continue to support them, they're going to be just fine.
Honestly, kids are impressive, and every year they impress me for a different reason. Amongst a pandemic, especially so. I think resilient, definitely.
One counselor believes that validating the challenges from this year might be exactly what students are looking for.
I tell kids it's okay to be upset. It's okay to be, uncomfortable with things. Let's talk about it and learn from that. So I think that's where a lot of their stress is just those social ties that they want.
But what they find is when they make those connections with kids, then they get the results that they're looking for. That students just need that extra connection. So they still feel part of the school, so they still have that one trusted adult.
No matter what, counselors want students and parents to know that we're in this together and there are resources to get help.
Wellness activities, and we really focus on that Wellness Wednesday. And we tell the kids we're focused on your well-being. And so we're going to do some of these activities. We're going to do breathing strategies with you. We're going to have you set goals and talk about what does a really good, strong goal look like, and then what are your supports to make sure you get that goal.
We don't like the situation of a pandemic. Nobody wants to be afraid for their health. But I feel like we are honestly doing everything we can to keep trudging on. Education is just one of those components. Healthcare, of course, is another. What do we do to get through this? And that's where we're at. So we're not going to surrender to it. We're going to keep fighting. And I think the most important way of doing that is through relationships. We have to reach in, if they're too afraid to reach out.
Fort Wayne Community Schools partnered with the Bowen Center to offer free counseling sessions for students. Mental health took center stage as more and more people worked from home, including Wayne 15 personalities. Reporters brought you the news of the day from inside their living rooms.
Nonprofit organizations have been especially hit hard during this pandemic, in particular those focusing on arts and culture. Many groups have come up with creative ways to financially stay afloat. Some performers in Fort Wayne put on a concert back in December called the Virtual Holiday Spectacular. Wayne 15 helped promote the event. Also from right here at the Embassy, something new this year, the Virtual Holiday Spectacular. The VHS fundraiser brought together more than 200 artists at separate times on the Embassy stage. It was a free event, but through donations raised more than $12,000 for the Artist Relief Fund, individual artists, and the Community Harvest Food Bank. Some of the groups that performed have also been getting help from Arts United. AU has established what's called the Arts and Culture Nonprofit Resilience Fund in partnership with community donors. That fund has secured more than $2.8 million to help organizations like the Fort Wayne Ballet stay on their toes.
This is a community that is known for saving itself during the floods of 1982 and has again and again demonstrated resilience. Nationwide, only 41% of arts and culture nonprofits are currently open. And in our community, the pandemic has not sidelined our arts and culture nonprofits.
The Arts and Culture Nonprofit Resilience Fund is helping 18 local arts and culture nonprofit organizations. In next week's Positively Fort Wayne, we'll take a more in-depth look at the Arts United Stories of Resilience campaign. Watch for the story Monday on First News and Nightcast.
What is it truly like to work at a hospital during the coronavirus pandemic? We've invited a doctor, nurse, and hospitality concierge to share the tragedies, fears, and even the hope experienced on the front lines of COVID-19. So, as frontline workers, what have you all seen that most people haven't?
What I see with other people, like our nurses, our doctors, they are tired. They are tired, but I promise you, they're like workhorses. They keep going, they keep fighting because they want to not only help people, but just save a life if they can.
Sometimes I look at the virus as it's a very unfair virus. Sorry, you need a feeding tube. Sorry, you need a tracheostomy tube now. Yeah, you were walking before, but we're sending you home in a wheelchair. because your lungs just can't support that activity. And it seems unfair, I think, sometimes. Or you have people who've been adhering to the social distancing and the masking, and they can still get it.
People can't see their family members, and that's very emotional. It was a lot. Someone came in to see their parent, and they weren't allowed to see their parent. They got emotional, they were crying, and I'm trying to, comfort them, and it was just, we got them calmed and the situation calmed, but it was just really an eye-opener because they were pressed to see their parent, who they haven't seen in weeks.
You hear about the no visitor policies in the different hospitals. They're difficult, and it's all part of this battle that we're going through, but it's so incredibly needed to keep us all safe.
Can you share a couple stories from the front line that have hit you hardest, ones that you'll never forget?
I was there when the doctor delivered the news that the patient's wife had passed. She was on another floor. She had COVID. It was hard for me to choke back the tears when he looked up at the doctor and said, "I've been with her for 62 years. That was hard.
Any silver linings in the past year?
I took a male patient down, an elderly gentleman, to the entrance there on Carew. And this young woman grabbed me and hugged me and said, "You gave my grandfather back to me." That's certainly was not practicing social distancing, but it was gratifying. And it was good to see grandfather walk out on his own two legs.
Because when they beat it, it's major. It's major. When they beat it, it's major. They're excited to, they're excited to go. They're excited to go home, but you see the family members come pick them up, and they jump out the car and thank you so much. And that's rewarding. That's rewarding.
Now that the vaccine is out, people are feeling hope. What is your outlook for 2021 now that the vaccine is rolling out?
It's given me a little bit of a glimpse of that light at the end of the tunnel where life will maybe get back to a new normal, but somewhat more normal. So it's been very encouraging.
To hear the full conversation with Parkview staff, find the story on Wayne.com. Kaitra K, Wayne 15 News.
Praise for healthcare workers came in many forms the past year, including first responders parading around hospitals. First responders tell Wayne 15 it was just a small gesture to recognize those putting their lives on the line to care for sick patients during a pandemic. For those healthcare workers, the recognition was deeply appreciated.
In the U.S., we reached a grim milestone of over 500,000 Americans have lost their lives to this pandemic. And when I think about that, and I think about the scale of what we've had to face as a public health crisis, it really is daunting. But the other thing that really strikes me is just the incredible response of our community. That outpouring of support and teamwork and collaboration has been really inspiring and has given us a lot of hope here at Parkview Health.
Recognition also extended to healthcare workers at Lutheran Health Network and the VA hospital, including a flyover by Fort Wayne's 122nd Fighter Wing.
Some Northeast Indiana residents held a moment of prayer for those in the hospitals.
Seeing the response is overwhelming. I didn't expect for it to be this big. Just a few people coming to pray for this community. Our country needs it right now.
But where do we go from here, and what does Indiana's future look like with COVID-19? If you're looking at the current state of Indiana, according to the county metrics, it looks promising. When it comes to community spread, the latest county metrics map shows more than half of Indiana is in the blue category, the lowest. This week, 51 counties are blue, the rest yellow. No counties are orange or red.
More Hoosiers can now sign up for the vaccine. Wednesday, Governor Eric Holcomb announced those 50 and older are now eligible. The governor says the next age group to get shots will be those 40 and up. No word yet, though, on when. In terms of vaccination numbers, here's how it all breaks down. 70% of those 80 and older have gotten their vaccines. 71% of Hoosiers 70 to 79 have gotten theirs. And 56% of those 60 to 69 are now vaccinated. Also, since Tuesday, 28% of Hoosiers 55 to 59 have already either been vaccinated or scheduled their appointments. Without a doubt, the pandemic is impacting the way each of us does our job. For the Allen County Health Department, the pandemic is their job. Every plan, complaint, violation, and enforcement goes through their office.
All without a battle-tested plan or playbook. Wayne 15's Chris Darby sat down exclusively with both Dr. Matthew Sutter and Administrator Mindy Waldron.
How long have you been with the Department of Health in your role?
26 years, I think.
How did this past year compare to the rest of those years?
You know, I had often said that it was like running a marathon, but at a sprinter's pace, because it was just a nonstop thing. But now I sort of feel like it was also a pentathlon, because you had to be a master of a number of things all at the same time with no notice to learn something new. For example, contact tracing in depth, doing testing, never having done that before, and then moving into vaccinations in a mass form that, despite training, we've never done in this number. So the last year is a bit of a blur, but a nonstop moving thing.
While the really global pandemic, the whole world was experiencing something like this for the first time. Locally, how much prep work was done ahead of this? How ready were we for a pandemic?
Well, to be real honest with you, one of the things that health departments do and have done since something like 2001 is extensive drilling for mass vaccination or mass medication type events. So every year we would do a number of things. I think we always had in our head that the worst case scenario could be truly mass vaccination, but for us that had always been a weekend, multiple days. So we had drilled it in concept, but not for the long haul. I would say, though, we were well prepared. We had the partnerships built. We had plans in place. We had facility agreements. We even had a stash of items to use when you couldn't get them. So we were pretty well ahead, and I think the community was blessed that the team of Allen County had already planned for this and were able to implement relatively quickly.
Yeah, the next question I was going to have was about the team and the health department itself. How's the staff holding up at this point? And, what has that experience been like for everyone working with the Department of Health?
I think they're holding up shockingly well for having not had much time off or a break or having done their regular duties. It's always been, we need you here or need you there, or this is what your job will be this week. But they're so responsive, so flexible. They work great as a team, and often these types of events, we've found it with H1N1 or any of our hepatitis A events, it kind of brings together folks that don't always work together in other buildings, and it creates a different team effect. And so it's been good. People have gotten to know each other, they work so well together, and they can pivot at the drop of a hat whenever we say we got to start this, or here's what we're doing today, or this is the problem that's come up. So we are very blessed to have the team that we have that works so well together, and they have a good time doing it too. And I think it's been well received. We're very happy.
Let's talk about a big change to that team at the top here. Dr. Sutter, you came along becoming a health commissioner as the pandemic was here. What was appealing to that? What was that idea of wanting to go after a position like this while we're going through this?
Well, I like to say I became health commissioner by accident. It really was not something I'd sought out. It wasn't really a career thing. But Dr. McMahon was retiring and needed to retire in the middle of a pandemic. And so some friends of mine are on the board and talk to me, and it's really been an amazing experience. I've learned so much this time. It's been so great working with the team. I didn't know the team, but I got to know Mindy and the rest, and it's an amazing group to work with.
What were your expectations going into that position with this going on, and how did you get yourself ready for that?
I assumed that everybody would hate me, and that it would be a difficult year. And so far, that's not been too far off. That's a joke. Actually, the community's been very gracious. I enjoy change, and I enjoy kind of new challenges, and so what Mindy has talked about the fact that we need to keep pivoting, that the information keeps changing, that things are uncertain, is actually appealing to me. I enjoy operating in that environment.
Maybe this is a similar answer about the uncertainty, but I was going to ask you, what were surprises? What were things that came across in this period of time that you didn't expect or the health department didn't expect?
Yeah, well, there are surprises all the way along. So the problem with a novel pandemic is we don't know that much about the virus. And the information changes all the time. That's the way science works, is there's initial hypotheses that get tested, and there'll be initial theories, and then we'll find out that no, that's not the case, and we have to pivot. So early on, we weren't convinced that cloth masks were helpful in any way. There was only one study out there about them previously, and it looked like they were not very effective. We've since that time found out that they're extremely effective. And in fact, when we look at our schools, when people are wearing cloth masks, we're just not seeing hardly any transmission. Totally unexpected. We expected that this would be a winter virus, and we saw this huge spike in November. But we expected that to last through the whole winter. The fact that seeing our cases go down right now is really unexpected. So every week, every month, there was something new and something unexpected. There was new information that we needed to take in and adjust for, and be able to communicate that to the community, who I think would really like a consistent message or just tell us how it is. And you can't do that in a rapidly evolving disaster like this.
Obviously, a situation like this is more about physical health, but a lot of us have gone through a lot of things mentally, emotionally in the past year. This is really for both of you, and Dr. Sutter, we'll start with you, but what kind of emotions have you gone through in this past year? How have you been able to get to this point?
Yeah, the downside to a respiratory virus is it spreads by simple human contact. The things that we as humans do to associate, of just getting close, sharing a meal, sitting around without something on our face, that's what we naturally want to do, and that's where we feel comfortable with. And we need to stop doing that to stop the spread of this. My emotions have been all over the place. They've been up and they've been down. But again, it's been a great team to work with, and it's been really great working with Mindy, because we can kind of keep each other on the straight path.
Yeah, Mindy, talk about that. What kind of emotions did you come across this past year? How are you still, up and running?
Well, it has been a challenging year, I'll be honest, because there has been so much change, and there has been a lot we have had to do without enough staffing and without enough funding. And so it really highlighted the strapped situation that public health is in Indiana, and I hope we learn from that and we move ahead and build that better. But personally, it's been difficult. It's a lot of hours, and I think for all the staff as well, there just haven't been breaks to rebound or to regroup. So it's always moving on to something else or changing something that day and doing something more. So me personally, it's been definitely up and down. Missed a lot of family time, those sorts of things. But it's on the other side of that, though, I feel like we have really, really stayed ahead of the curve because we didn't let our guard down, because we didn't take those breaks. We were able to be there when needed. I would say our response time to needs in the community or emails for decisions for other entities or partnerships with schools, what have you, have been able to be there because we've decided to commit and that we wanted to be here for the long haul. So I feel good about what we've done. I never look back and say, man, I wish we wouldn't have taken that bit of time off. We didn't do it, and I think we were able to respond in real time to whatever was needed. So it's definitely up and down mentally for everyone involved, but overall, I hope we come out on the other side having done our very best.
There's going to be a lot we remember for this past year. All of us are going to have specific memories of this whole pandemic, but what memories, especially interactions with other people in our community, have left an impact that maybe you'll never forget?
For me, it's harder to think about the last year. I need, sometimes I need prompting of all the things we did, but right now we're engaged in vaccinations, masks. And we started with the elderly, and those folks have been the easiest to work with, great people. And I think one of the memories I'll always have is just last week we had a couple that came in, and when they left, they wanted to specifically say to our staff that this had been the best day of their life. because they had been cooped up for a year, being very safe, and this was a bit of a ticket to be able to maybe be out a little bit safer and see family members. And for them to say that, as well as a number of other things that have happened during vaccination, because that's a bit of looking down the tunnel and getting out, we've had such good comments about our efforts, and I think those are the things that a lot of us are hanging on to right now so we can make it through. So I'll always remember those things.
Yeah, Dr. Sutter, what sticks out in your mind of memorable stories or anything that's left an impact on you?
You know, I think shortly after I came on board, we were kind of faced with a decision about what to do about contact tracing. Up to that point, the state had initially we did contact tracing very early. The state had taken that over, and we were kind of faced with a decision about what we did about that. And we decided to bring that back. We did it in tandem with the state, but what that did is it really allowed us to have clear, actionable intelligence about what was actually going on and where we were seeing transmission. We set up a daily meeting where for a half hour every day, we sit and we talk about the cases. We continue that ever since. But I just think that ability to sit down, gather that, make a decision, and then do something that really works well for the community to allow us to drive our other decisions was really important. It's something I remember.
What does a year look like from now? We're sitting here talking in a year. You know, what do we hope to see? What's the goal?
Well, what I hope to see is that people are pretty much back to normal. I think there's good reason to think that the vaccination will drive this to basically become the flu or less than the flu. I don't know that SARS-CoV-2 is going to go away. I think it will continue, but I think we'll be in a very different place. What that means is we may still need boosters. We don't need that, know that on the vaccine. It's possible we'll have to wear a mask for a while. I can't really tell how long. But these vaccines have just been spectacular at knocking out hospitalization and avoiding death. And that's amazing. So right now the goal is get as many people as possible vaccinated and drive the risk down to that or below what the flu is, because we know how to deal with the flu.
As we're looking back on a year and looking ahead to try to get to the end of this, words for the community?
To stay strong just a little bit longer, that we've got a little ways till we get outside of that tunnel, but we can see the light now. So if we can continue to mask and distance and be safe in our events that we might be starting to open up or things that we might be planning to travel, those sorts of things, if we can stay strong, stay diligent, all the while getting the best uptake we can with vaccines, you know, we might get closer to the end of that tunnel quicker, but in a safe way. Last thing we want is an uptake. So my words would be, let's just hang on as a community as long as we can until we hear those words that, hey, we're getting there. So if we can be diligent.
Yeah, Dr. Sutter?
Yeah, so there really looks to be light at the end of the tunnel. The vaccines are doing a tremendous job. And while they're not rolling out as quickly as we'd like to see, that's starting to ramp up, and we expect that to continue to accelerate over the next couple months. But the big thing is we're in this strange phase right now where we can see the end or see an end, but there's still risk. So if people suddenly change their behavior, stop wearing masks, stop social distancing, or decide not to get the vaccine, we could still see big spikes in cases and spikes in deaths as a result. More than 500,000 Americans are dead of this disease, which is a truly staggering number. And the people who are dying now are people who are potentially avoidable because the vaccines are doing fantastic at stopping death. So people need to hold on for a little bit longer, exercise some discipline for a little bit longer, but there's light at the end of the tunnel.
To all of the essential workers on the front lines, thank you. We know every day can be unknown and scary, but just know how grateful we are for what you do every day.
A huge thank you to all of the doctors, the nurses, medical support staff that are keeping us safe every day.
I can't thank the essential workers enough for putting their life on the line to take care of all of us. You're the real heroes.
Thank you, thank you, thank you, thank you. We cannot say thank you enough to all of the healthcare professionals out there doing their part to keep us safe during this pandemic.
We just want to thank you from the bottom of our hearts for every single thing that you're doing, for being out there on the front lines and making it safer for people like us.
all the nurses, doctors, and medical personnel out there here in the Summit City area, thank you very much for putting yourself on the front line and for keeping us safe in this uncertain time.
To all my friends out there in the medical community, boy, we could not be getting through this time without you. We love your dedication, your commitment to taking care of us, to helping us through these difficult times. We'll see better days ahead. Thank you so much.
Doctors, nurses, healthcare workers, we owe you such a debt of gratitude. Thank you for being on the front lines and fighting this pandemic, overcoming your fears, and making us all proud.
I have a sister who is a doctor working on the front lines in Ohio. She conveys to me the importance of making sure you wear a mask. To all of you healthcare workers, thank you for everything you're doing. We really appreciate you putting your lives on the line.
The pandemic has frequently brought out the best of Northeast Indiana. While herd immunity appears to be in sight, roughly 1,300 people in our region are confirmed to have died from COVID-19.
This virus has forever changed their expectations of a new normal. Perhaps above anyone else, they are the true heroes. We want to thank you for trusting Wayne 15 and Wayne.com during what has been truly a life-changing year.
Just know, whatever happens next, we'll be here with local coverage you can count on.